And this is different than anything, any clinic around.
Workouts that are tailored for her, and that really makes a difference.
Really personal. I've gotten way more mobile, stronger, flexible. So everything just improves me to the next level.
Welcome to the On Cue Performance Therapy Podcast, where we push sports performance and physical therapy to its apex. We change the game by bringing together the brightest minds in the field to offer best practices and question how things are done today. I'm your host, Mike Quintons, physical therapist and expert in sports orthopedics. I'm living my dream and opened a clinic that unites all elements of sports medicine under one roof to drive recovery and performance outcomes.
I'm here with Dr. Kelly Scollon-Grieve with Premier Orthopedics, as well as members of my staff. We have Joe Bertucci, Jennifer O'Gara, Nicholas Barbieri, and Alana DiBiase. So here's an introduction. Dr. Scollon-Grieve is in Wayne as well as Havertown, Boston University, and you do everything from stem cell injections, PRP, and you have a beautiful center in Wayne now that you're working at. So tell us a little bit about yourself and your new location.
Thanks for having me. Yep, I've been in our office in Havertown for 9 years, and we just opened the new office in Wayne in February. It's a beautiful new office near King of Prussia, so it's a great location for everyone to access. And the main goal, Dr. Jeffrey Berger and I opened that office, was to have a more intimate setting for patients that were really more interested in their health and wellness and regenerative medicine, which would encompass things such as platelet-rich plasma and bone marrow stem cell injections. So that was the goal for that location. However, we do all kinds of conservative, non-operative orthopedic treatments such as epidural injections, all kinds of spinal injections under fluoroscopy, injections under ultrasound guidance, as well as diagnostic ultrasound. So we kind of take care of everything from head to toe for anybody that wants to avoid surgery.
And so the Regenexx is what jumps off the page for me. So you've been a Premier for how many years now?
9 and a half.
Awesome.
Yeah.
And the location in Wayne opened how long ago?
In February, about a month before the COVID shutdown.
Of course, right. And I remember seeing you, I think, in March. Maybe it was April. And it was starting to take off a little bit leading into it, and you guys have rebounded. So I'm curious, tell us what Regenexx is all about and the types of treatments that you do.
So Jeff Berger and I started with Regenexx in February. We have a lab set up in our new office in Wayne. So Regenexx is an international company that develops platelet-rich plasma and stem cell treatments and protocols that are a bit different than the traditional way of doing platelet-rich plasma that a lot of doctors have been doing for a long time, which, including myself. I've done that for 10 or 15 years, using the traditional bedside centrifuge for the PRP, which is a product using your own blood, where you concentrate the platelets. The way that Regenexx does it, it's a more comprehensive approach and different protocols to increase the concentration of the platelets much higher than you can get with the traditional bedside centrifuges. So we process it in our sterile lab environment so we can get much better results and outcomes, as well as just treating the whole patient rather than their tennis elbow or a herniated disc. We look at everything and often find there's other issues that need to be addressed to prevent that injury from recurring again. So Regenexx is basically an international company that has providers that we have to go through extensive training with them so that we can adhere to their protocols. And we definitely have much better outcomes and safety measures with that.
That's really interesting in that I have some experience with PRP and stem cells in terms of learning a little bit about it, but to have like a national organization that makes sure it's almost like ART for us or Graston for us, where we go through these certification procedures now like we are the official providers of that that technique, and we know what we're doing, and it's proven because of these reasons.
Yeah.
That's pretty cool. I'm gonna open up for questions. Anybody get shoot away, guys?
I'm just curious if you've seen a difference between like the old technique and the new technique,
Yeah.
and what that difference would be.
Yeah, I definitely have. With the old way, we still had lots of patients that had great results. But I'd say for the most part, for a typical tennis elbow, people usually respond well to PRP. After they've failed physical therapy, we would do PRP. And with the old way, a lot of times we would have to do 2 or 3 treatments. Now with the newer way, we get a much higher concentration of the platelets. It's usually 1 treatment and that's it. So that's the main thing that I've definitely seen with the increased concentrations, that 1 treatment is usually enough versus having to do multiple.
Yeah, that's going to be one of my questions, was in terms of the patient experience, having that administered to them, what the difference is between the Regenexx versus kind of the old methods.
Yeah, so when somebody comes in specifically asking for a Regenexx procedure, we usually schedule them for an hour-long consultation, because we're always thorough, but definitely even more thorough with patients that have gone through all these other avenues, therapy. Sometimes they've even had surgery that failed, so they're usually typically complicated patients. So we really want to evaluate them from head to toe, not just their knee or their hip or whatever they come in for, because usually there's some other underlying issue contributing to that. So I usually spend an hour or more with them reviewing all of their imaging, possibly ordering new imaging. I usually evaluate them with musculoskeletal ultrasound there in the office, depending on what their issues are. Just evaluate everything in a kinetic chain, and then we come up with a treatment plan. So for instance, somebody might come in with knee arthritis or meniscus tear and just think that's their main issue, but then through our thorough exam, you might realize that you might have a little nerve irritation coming from your lumbar spine. When you question them, they say, oh yeah, I do have some back pain. So if we treat that in addition to the knee, the outcomes are a lot better. And in the past, and a lot of physicians around the country still practice that way. They'll just look at the knee, that's it, treat the knee, and then when the patient doesn't respond, they kind of throw their hands up in the air and like, I'm not sure what else to do for you. So we are very comprehensive. And as a physiatrist, physical medicine and rehabilitation, that's kind of how we're trained to evaluate the whole person anyway. Not to knock any physicians that are focused on hips or knee replacements, but that's just how we're trained, and I find it to be more effective when you look at the whole patient and incorporate other therapies. All of our patients are in physical therapy, usually pre and post treatments. You can't just inject a knee and send them on their way and expect them to be 100% better.
What's the mean age range between that you usually see?
Really, I've seen teenagers with a lot of different tendon or ligament tears to 90-year-olds with arthritis or a rotator cuff tear, where they, if you're 90 years old, you don't want to go through rotator cuff surgery or shoulder replacement. You just want to have some improvement of your pain and function. So by treating them with PRP, their own blood platelets or their own bone marrow cells, they can improve their function and pain and avoid surgery. They might not be 100%, but if they're 90 and they can do what they want to do and not go under the knife, they're happy with that. But I do see teenagers as well. I'd say that the majority of patients are 30 to 60, but I really see the whole spectrum.
And for your athlete, what's the range for return to play?
It really varies. So we do, if somebody has a partial ACL tear, we can actually treat that with either bone marrow or PRP. So that's a much longer recovery, but not as long as if they were going to have surgery. But if somebody has some tendinopathy or a partial tear in their tendon, usually it's about 6 weeks.
6 weeks.
Yeah, we would do the injection, have them rest for about a week, then go into the rehab program, and I would reevaluate about a month, and then usually by 6 weeks, depending on the severity of the injury and how the patient responds, it's usually about 6 weeks. But oftentimes that's after they've already rested and gone through therapy and weren't getting better, so they probably have been out for a much longer time before I saw them.
Now, do you usually use like either PRP and stem cell, or is there a time when you can combine both?
So when we do the stem cell, which is from bone marrow, not from umbilical cord or anything else, it's from your own bone marrow, so it's safe. It's actually a 3-step process where, so for instance, we're doing somebody for knee arthritis. They would come in one day, we do prolotherapy, which is just sugar water injection into the knee, and that helps to just prime your body for those cells. And then a few days later, they'll come back and we draw their bone marrow, process that, inject it. They might need multiple areas injected depending on what the issue is. And then a few days after that, they come back and we do PRP. So it's a few steps for that. And then for more mild issues, we just do PRP or a combination of PRP and prolotherapy. And the majority of our patients just need the PRP. The bone marrow is really reserved for people that have either failed PRP or have more moderate to severe arthritis or a larger thickness tear in the rotator cuff or any other tendons or ligaments. And then we would go to the bone marrow.
No, I was just saying, like, is there a reason why, like, it's like more severe case that you're going to go through stem cell? Is it because, like, there's not in a verse respect, like, there's just not enough research yet supporting the stem cell? Is that why you guys kind of hold up and wait?
Yeah, so Regenexx has been following patients for 20 years, and there's a national registry with all of the providers that do the Regenexx treatments. So and they do a lot of research, and they've shown over the years that patients that with more moderate to severe issues don't necessarily respond well to just doing the PRP, so they would recommend bone marrow over that. And the people with PRP works really well for tendons and ligaments and mild arthritis issues, so there's no need to put somebody through taking their bone marrow out if just getting a little blood from their vein will do the trick. So we try to be as minimally invasive as possible.
What's interesting about this to me is that these are patients, active individuals who are putting off doing such a surgery, or not putting off, maybe they don't want to avoid it altogether, not necessarily put it off. So anything from arthritis to ligaments, tendon tears, so like the chronic ankle sprain, you would see the Achilles tendon partial tear, you would see. So I'm curious where you feel like PRP is awesome for this injury, or like if someone comes in with tennis elbow, you're thinking, okay, got it, like it's going to be PRP. And I'm sure you're looking at the rotator cuff to see that's involved. So are there certain, and I love the sequence of Prolo, PRP, or stem cells and PRP. I've never heard of that. Maybe that's only Regenexx, but I've heard of each one individually. But to use all three is like, okay, like you're getting shotgun effect and you're going to get all of it. So I'm curious as to, are there certain body regions where you want to apply individual methods? And what have you seen the most success with? Like what patient is ideal for somebody like you?
Typically anybody with a chronic tendon or ligament issue, or even a subacute issue, the PRP is the way to go. The bone marrow works well for more moderate arthritis in the knee, any joint really, or rotator cuff tears that are more moderate in severity. The bone marrow can certainly work to heal them and improve space function. We also do procedures for the spine as well, which is different. There aren't too many physicians in the area that do these regenerative procedures for the spine. So for the spine, we use PRP, and we process it in a certain way that it actually opens up the platelets so that it's safer to inject. It's safe to inject in the spine. So instead of doing epidural with cortisone, we do an epidural with your own blood platelets, which has its own natural healing effects, no downside to causing any weakness of the muscles or ligaments. So we do a lot of that for the spine for patients that have either failed cortisone injections, don't want cortisone in their body because they've heard about the potential bad side effects, or they've gone through everything and they're being told they need to have either a discectomy or a fusion or some spine surgery that they just don't want to go through.
Thanks for listening to the On Cue Performance Therapy Podcast. If you like this episode, please subscribe on Apple Podcasts and Spotify. It would mean so much to me if you could leave us a 5-star review so more listeners like you could get this important information. See you next time.